Chairman Sensenbrenner. I'm pleased to be here today at this important hearing and to examine the growing epidemic of heroin abuse in our nation. Over the past several months, we've seen an alarming increase in both the availability and use of heroin. This has, not surprisingly, had profound and tragic consequences. Every day, it seems, brings new stories of overdose deaths occurring across the country, including in my district. Since January, there have been 11 heroin-related overdoses in the Roanoke Valley, resulting in 9 deaths. Earlier this year, the Washington Post reported that the legalization and subsequent availability of high-grade marijuana to American consumers has led Mexican drug cartels to increase the amounts of heroin and methamphetamine they are trafficking across the U.S.-Mexico border. Since 2009, heroin seizures along the border have nearly tripled as law enforcement seized 2,181 kilograms of Mexican heroin last year alone. These are alarming statistics. However, the grim reality is that they should surprise no one. Drug trafficking is an extremely profitable business run by criminals who are interested in one thing: money. Given the increasing availability of marijuana in the United States and the related ongoing epidemic of heroin use, drug traffickers have decided to cash in on the misery of American citizens. Additionally, the Drug Enforcement Administration estimates that the United States has 600,000 heroin users, which is 3 times the number in 2012. Tragically, that number is expected to rise, and that is because there are an estimated 10 million Americans who are currently addicted to prescription opioids, including such drugs as Vicodin, OxyContin, and Percocet. Once someone is addicted to a prescription opioid, the need to satisfy their addiction outweighs the stigma attached to heroin use. Additionally, it is far easier to pay $10 for a dose of heroin than $80 for an oxycodone tablet. It is no exaggeration to say that heroin use has reached epidemic levels across this nation, including in my home state of Virginia. It is not an urban problem or a rural problem, but an American public health and safety problem. However, despite the increase in heroin and meth production, despite the ongoing heroin epidemic, despite the dramatic surge in deaths, and despite the clear evidence that illicit controlled substances and their purveyors pose a lethal threat to the American people, the Obama administration has continued to shirk its duty to protect this nation from dangerous narcotics. I firmly believe that any solution to the heroin epidemic must have 3 parts. 1, discouraging the use of this dangerous, highly addictive drug. 2, providing appropriate treatment to addicts. And 3, ensuring law enforcement zealously pursues the criminals who bring this poison into our communities. I look forward to the witness's testimony today.